Good evening, everybody. Welcome to the webinar Bengaluru Fights Corona, episode 4. And this is about how to prevent COVID-19, the third wave. We have with us our distinguished guest of the day today, Sri Rajiv Chandrasekhar, MOS Union Minister, MOS of Skill Development and Entrepreneurship, MOS for Electronics and Information Technology. We welcome you, sir.
Thank you. Thank you.
Yeah. We also have with us Dr. Vishal Rao, who's Regional Director and Dean of HCG Cancer Center, Bengaluru, who's a familiar face for all of us and has been in the COVID task force in Bengaluru during the COVID pandemic, the second wave. We also have with us Dr. Vivek Padigal, Director of Pulmonology from the Fortis Hospital, Bangalore. A brief about Sri Rajiv Chandrasekhar ji, who is also our fond Bengalurian who has been in our civic rights and advocacy and activism in partnership with all our civic campaign cause for the cause of Bengaluru. He's been elected in Rajya Sabha from 2006 and has worked untiringly for the last 15 years for the betterment of Bengaluru. Few of the highlights of Rajiv ji is as follows. He is the youngest FICCI president in India. He has started the Flags of Honor Foundation for Captain Saurav Kalia and also filed a petition in the Human Rights Council. He's also fought for one rank, one pension. He's also part of the Armed Forces Voting Rights coalition that he actually led the team. He also did the Ask Seek online campaign for the citizens to directly voice their opinions in the parliament. So without further ado, I would like to welcome Sri Rajiv sir for his opening remarks, please. Welcome, sir.
Thank you. Thank you. Dr. Rao and Dr. Padigal and all of you who've kindly joined this webinar today. Thank you all. Thank you for joining on a Saturday evening. Thank you, Bengaluru, for inviting me. I think as we reach a very critical stage in our national fight against the COVID-19 and of course our city's efforts at prevailing over this very unprecedented global pandemic that has in a sense affected lives, livelihoods and economies not just of countries in the West and countries overall like ourselves, but has also affected lives and livelihoods at the smallest districts and panchayats and towns and cities all over the country. It may be a good idea for us to just look back on this journey of the last 18-19 months that we have traveled as a country, as a city, as a people, and in a sense take stock of where we are and make sure that we are aware that the third wave is a real threat. It is not an academic threat. Look at some of the things that we did after the first wave that caused this really frightening and unprecedented high velocity second wave that took all of us by, whether it's the government, whether it's the citizen and the health system, all of us were almost overwhelmed by the ferocity and the velocity of the second wave, and we for those 2-3 weeks in April and May, and then of course due to a concerted effort by the government of India and the leadership of our Prime Minister and cities and state governments, we were able to build up the capacities of what was required. But one of the clear learnings from that is that we don't want that to happen again. It took a tremendous amount of cost, it took a tremendous amount of toll on both human and otherwise to face and prevail in a sense or blunt the ferocity of the second wave. So this looking back is my effort at getting all of us to work together to make sure that the third wave just does not happen in Bengaluru. And as you know, Bengaluru is showing an uptick in numbers in recent days. and that is not a good thing for us, and it's something to be not. I don't want people to get worried and scared and panicked, but it is something that we should be very, very aware of, that we don't want to go back to April and May. Just a quick, just to remind ourselves, because we tend to forget sometimes how we have come to this stage. It was in early January of 2020 that the China first told the world about this detection of this virus. By mid-January, the government of India had swung into action and had put into place travel advisories, medical advisories, in not that urgent a way, because everybody in the world was still flying very blind and was grappling with the unknown. Nobody knew the ferocity of this, excepting to know that there was something out there. But we responded well. We ramped up on infrastructure. We ramped up all the requirements that we needed for combating the first wave. And we thought by October of 2020 we had the worst was behind us, because we had come down to about 1 lakh overall. We had come down to less than 1 lakh a month of infections around the country. And we thought we had really, and we not just we thought, the world wrote about this, that India had managed through a combination of governmental action, citizens resilience, citizen response, lockdowns, all of that, and the healthcare system and the healthcare warriors that had sprung into action, that we had avoided a very bad situation like the US was going through, the Western Europe was going through, and some other countries were going through. Then we saw in January and February what happened as a result of a lot of these epicenters that developed in Punjab, Mumbai, Maharashtra, and Kerala. How quickly that second wave spread and caught us totally unaware, whether it's the state governments, city governments, or the national government, in terms of oxygen requirements, the medicine requirements, the health capacity requirements in terms of hospital beds, all of that. And that period was indeed a very, in my opinion, I say this individually, was in a large effect, to large measure, we could have avoided that if we had been careful in the months of December, January, and especially October, November, December, January. But I think everybody across the board took it for granted that the worst was behind us, and we stopped being paranoid. We stopped being paranoid a little too early, and so then we had to go through what we have gone through. We are today in a much better situation as a country. Today, 500 million Indians have been vaccinated. The vaccination process is ramping up. Today, Johnson & Johnson single shot has been approved for emergency use. And so I think we will be on course today to vaccinate 1 billion plus Indians by the end of this calendar year, by December, give or take a few weeks. And I think given all of that, it is extremely important, in my opinion, and I say this not as a minister or as a MP, as a fellow citizen or a fellow Bengalurian, that we spread the word through our own networks, through our RWAs, through our communities, that we are not done with this yet. It is sensible to be a little paranoid. It is sensible to be worried. It is sensible to be aware that this virus is still out there. And for all of the other discourse that we have to learn to live with the virus, we have to learn to live with this reality of this type of recurring sort of infections. We have to be clear that we have to be careful. We have to mask up. We have to socially distance. We have to be careful in terms of large congregations. Our behavior has to move to a new normal. So if people tell us that living with the virus is the new normal, then behaving differently is the new normal. There is and until somebody flags a green light and says all clear, like we have in stations and railway tracks, and say all clear, don't worry, the virus is gone, till that day, I think it is our duty as individual citizens, it is a duty to our communities, to our families, that we maintain a certain discipline, a certain new normal in terms of how we live. And getting vaccinated, getting the second vaccine, spreading the word in our community that getting vaccinated is important, because not important for just themselves and their families, it is also important for the community that they live in. So getting vaccinated, getting the second vaccination, masking up, maintaining social distancing protocol and the discipline for the conceivable next few months, till somebody in Delhi, our Honorable Prime Minister or the Health Minister flags of green flag and says, look, we are done with this. Till then, we have to live with the new normal. So, because there are a lot of intellectual points that are being made that we have to learn to live with the virus. And I don't disagree with that. And I think the two doctors today who are on the panel will stress that. But I hope they stress that. But if that is the case and we believe that, then we have to also learn to live with a new normal in terms of how we live. And so getting vaccinated, getting our second vaccine, masking up, avoiding avoiding big crowds, being aware every day that the risk is out there, and telling people around us, around you, in the community, that the risk remains intact. So anybody who today says that, oh, the COVID third wave is gone, it's never going to come back, I'm sorry to use a strong word, is a fool. And we are all Bengalurians, and no one calls us fools. We are all known as very intelligent people, very aware people. We lead the country in terms of many things. And I think in terms of our personal conduct, our familial conduct, our community's conduct, continuing to engage with the healthcare system, getting vaccinations to as large a number of people in our network and in our friends and family is the right way to prepare ourselves for the third wave. From all of my understanding from the briefings that we get from experts, and I don't claim to be a healthcare expert. There are two very eminent doctors on the panel who are healthcare experts and who will obviously tell you more. But from all of the talk that I have had from multiple healthcare experts in India and abroad, the message is very clear. This thing is not done till it is done. This virus is not going to leave the borders of India and go somewhere on a holiday till we make it go on a holiday. And it requires a considerable amount of effort on our part to ensure that we don't go back to third wave. Our economy, our lives and livelihoods, even in the second wave, has been impacted. If you just think of it that in March 2021, the prognosis was a 12.5% growth for this year. And because of the second wave, the growth rate has had to be tempered down to 9.5-10%. So, and those are real numbers, real revenues, real jobs, real livelihoods. So the reason I wanted to engage with you today, of course, was to say that you're all outstanding leaders in your own communities, in your own fields, in your own in your own resident neighborhoods. Please spread the word. Please spread the message that this risk is a real risk, and we have to as a city, we have to as a state, just absolutely make sure that we don't go into a third wave, and we can't do this unless each citizen is aware of the real risk that remains of a third wave. I will end there, but I will also want to just share with all of you, and I'm sure you also want to share the joy of Neeraj Chopra today winning a gold medal. It's an epic way for us to finish the gold medal. A young lady from Bengaluru, Aditi Ashok, made us proud with her grit and her performance in the Olympics golf tournament. She's a proud Bengalurian, and I'm very proud of her, as we all should be. She didn't make it with a medal, but I think she's a champ. Without a doubt that she, as rated number 200 in the world, took on bigger and much more experienced people than her and gave a big, solid run for the money there. So I think it's a great Olympics for us also, where never before have we won so many medals as a nation. So gold, silver, and multiple bronzes. Started with Mirabai Chanu, amazing lady in the Northeast. And we end with Neeraj Chopra with the story of Aditi Ashok as true grit, and that I think should inspire us as a city as individual citizen leaders in the city that we will overcome this third wave threat as well by being smart and by being disciplined. Thank you all. I'm happy to take some questions if anybody has any questions, or I'll wait and I'll hear the two doctors speak for a few minutes before I log out.
Thank you, sir. Sir, thank you very much, sir. Thank you very much for those opening remarks and comments, and especially we as Bangaloreans, thank you for in your busy schedule to be here, and also the sort of resilient behavior that we need to bring in to stop the spread and reduce the risk in our society, sir. Thank you. Now I would call upon Dr. Vishal Rao, who is a regional director and dean of HCG Cancer Institute, Bangalore. He's a TEDx speaker and also an innovator. He has invented the home voice prosthetic device. It was for only $1. And Dr. Vishal Rao has been a member of the COVID Task Force, Karnataka. Thank you, doctor. Thank you for being with us. And we would like you to make your opening remarks. Welcome, sir.
Thank you. Thank you, Vinod. Thank you, Nama Bengaluru Foundation, for all these efforts through the pandemic. And my pranams to Shri Rajiv Chandrasekhar ji for the wonderful introductory points that he has mentioned. I think what I would like to, in a few minutes, quickly sum up is, I have called this the World War C. You know, the earlier meeting that the NBF conducted, I actually presented that entire episode, and I believe this actually is the World War C. We couldn't explain this better than this. And at this juncture, while we are at the third wave, and I think there are a lot of things that we need to learn from the second wave. Like I often say, that in COVID, there is a tendency of symptoms to lose the sense of smell, but a lot of people also lost common sense, not just a sense of smell. And one of the things, like Rajiv sir said, was the aspect of saying that we won over it prematurely. There's a whole lot of things out here, but I would like to take a quick recap before we talk about third wave into what happened in second wave. And I'm a member of the Genomic Surveillance Committee, and there are a lot of interesting learning for us across the world. And one of the most interesting learning was, we assumed that Karnataka is different from Maharashtra, which is different from Kerala. No, that is also a myth among the people. The most important thing around the Delta variant, and since the Delta variant has been the talk of the town, I'm going to give a couple of briefs on how this mutation changes. Today, as per the Government of India's report, we have found 25,000 odd mutations in this virus, and we have found 8,572 new strains, the new variant strains, which have been of concern. Now, every time that we behave foolish, we are actually allowing this virus to move, because I always say that this virus doesn't have hands and legs. It is we who are moving this virus. So we cannot be saying that we are going to move this virus and then ask for a bed and say that you arrange a bed. I keep saying this, that our healthcare system, 1.5 years, our doctors have dedicated their lives for this country, for these people, and continue to serve it. The responsibility of our citizens lies in the hands of ourselves, that we are the ones who move the virus. We cannot after that tell the government that you arrange for a bed, or the hospital to say that we will prepare this. And for this, it is very, very important for us to understand that when we create a hospital in a society, it is created for a small bit of population. It is not created for the entire population. So no governments of the world can cater to a full population to be admitted into hospitals. No, it can't be one. Just by the learnings of March, April, I would like to recount. In March first week, our total positivity rate was 0.5%. By end of March, we were at 4%. And in April first week, we touched 5%. And end of April, by the time we started lockdown, we had 25%. The learning from this was, the virus jumps, after it touches the critical value of 5%, it jumps in logarithmic scales. So we cannot say that we will wait and watch. And I'm glad that Karnataka government today has put a huge stop to social and entertainment activities, because this is not the time for social and entertainment activities. And I think I would like to end with a small note from the Singapore model, the end of circuit breaker model by Singapore, which very beautifully summarized unlock in 3 phases. It said safe transition, safe reopening, safe transition, and lastly, it was said about safe state. Now, the 3 important things that they said was, when you do the safe reopening, that is the time you keep closely watching the total positivity rate. Today in Karnataka, there are districts that have crossed 5%, like Dakshina Kannada, Udupi, Kodagu, districts that have started climbing the number of 5%. We need to be first understanding that moment it touches 5%, please understand, somewhere it is not that the virus is sitting and taking rest in between. When we are saying that the curve has flattened, it is at that time that the virus is actually preparing itself to actually mount the next response, but we are behaving ourselves, and that is the time it wants to change its form. So the safe reopening very importantly talks about the 5% positivity rate monitoring to keep it below it, and to curb social and entertainment activities. Now, after a couple of weeks, then we move into safe transition, when we slowly start opening social and entertainment activities while keeping emphasis on the economic activities. And I know that the government of India, citizens are all working hard to run the economy. At this juncture, economy is extremely important to be run. And I think Rajiv sir is also playing the role of the Minister for Skill Development. And I believe the most important message that he has been emphasizing across is, we need to be productive India at this time. We have to be productive, and we have to ensure that we contribute to the economy, not say that nobody has told you to stay still. But what we have said is, when you run your economy, please ensure that you run it like your clinic or hospital. Ensure that there are 3 important things that are going to change the game for this particular pandemic: the mask, your vaccination, and ventilation. These are the 3 things that are going to change the game for third wave. And I think today's efforts of Namma Bengaluru are to reinforce these 3 important points: wear your mask, get vaccinated, and ventilate your homes or your workplaces. Switch on your AC and open the window if you want to do it. But please remember these 3 points, and we will win the third wave. We will prevent the third wave, because it is our responsibility. And if we do so, then we will enter into the last phase, that is safe state, where we vaccinate ourselves. And I think vaccine passport is a must. I think coming days, I'm also going to be interacting with FICCI and others, requesting that every economic zone needs to be run like a hospital or a clinic, and everybody needs to have a vaccine passport. And lastly, I just want to close by saying that there's a lot of myths and confusions about booster vaccines, about modified new vaccines, and which is creating more confusion among people in vaccine hesitancy. Please do not get into all these kind of confused discussions. Globally, today we know that there are many variants that are coming in, but all of them seem to be effective against the current vaccines. And already enough of efforts have been put to make vaccines available. Please vaccinate yourself, and remember that these mutants are going to change. If you give them an accommodation in your body, don't give an accommodation for these particular mutants. And with this, I think I would like to thank Rajiv Chandrasekhar sir for giving me this opportunity and platform. Vinod, thank you for hosting us. And if there's any question towards the end, I'll be happy to answer it. Thank you very much. Namaskar.
Thank you, Dr. Vishal Rao. That was really good of your safe reopening, safe transitioning, and also the making our cities a
safe state and safe Bengaluru.
Yes, safe Bengaluru.
I think our gift from Namma Bengaluru will be this.
Yes, very true, Doctor. Thank you so much. Yeah. Now I'd like to call upon Dr. Vivek Padigal, who is a senior consultant and director of pulmonary services at the Fortis Hospital, Benagata Road, and he's also been a frontline COVID doctor and also seen about 3 pandemics. So I'll quickly ask you to open up, since Rajiv sir also has to leave in a short while.
No, I'll stay.
Okay, sir.
I'll stay till Dr. Padigal speaks.
Okay, sir. Thank you, sir. So Dr. Vivek Padigal, welcome. And we would like you to start your opening remarks, sir. Thank you.
Good evening, and I really would like to thank Namma Bengaluru Foundation for giving the opportunity to participate. The Honorable Rajiv Chandrasekhar, definitely, thank you, and Dr. Vishal Rao. Both of you have covered many things, and I really probably don't have so much to add after that, but I'll give it a shot. I have been from the front lines from the beginning. We had our first patient about April last year. There was a lady from the UK who sat in our ward for about 2.5, 3 weeks because she really never tested negative. But we've come a long, long way in that journey. We went from 1 to 5 to 7 in the first wave and finally to a full ward. What was different about this wave was the tempo. It started, it hit, it rose exponentially, didn't give us a break, didn't give us a chance to prepare. And we went from 5 to almost 275 patients with a span of a few weeks. So it was just simply explosive. I think we all remember, or some of us remember. I'm beginning to think a lot of people are forgetting now. Running out of beds, telling people that I couldn't accommodate them, telling my friends and family that I can't help them. It was very traumatic in that sense. We were running out of medications, running out of beds. It was very, very difficult. So I think the short message really is, please don't forget. I think looking at the behavior in Bangalore over the last few weeks, every week that we come out of it, people seem to be forgetting that what just happened. I don't think there's a single person in Bangalore who hasn't been touched by death and COVID. I think each and every one of us know directly or indirectly of somebody who's died from the disease. And this time around, it wasn't just old people. Even that is tragic. We had 30, 40, 50-year-old people in our ICU, and some of them succumbed to the disease. So it's a dead serious disease that needs to be taken very seriously. So if we don't forget, hopefully we modify our behavior. I think the number one thing that will protect us and protect us, having to protect you, is vaccination. So I would really, really encourage everybody to please get vaccinated. Good news is that our vaccination numbers, at least in Bangalore, are fantastic. We're reaching 70% of at least one shot, which is very, very good. Tied to that, our seroprevalence is quite high right now. So between these two, I think we'll have a respite. I'm calling it a respite because we don't know what's going to happen in 3 months. Seroprevalence is not an indicator that you're not going to have another wave. Second thing is masking. I think masking is an incredible, cheap, reproducible thing that can be done immediately. There's no rollout, there's no distribution. If we all wear our masks, there are estimations that up to 70% of transmission can decrease. And we're worried about efficacy of vaccines. We're worried about, is it going to protect us? But if you vaccinate and wear your mask, you're going to be pretty safe. And if everybody masks, everybody's going to be safe. So that's really important. I think social distancing still has to be done. As the science has evolved, we've seen that 6 feet may not be enough, but if you mask and have 6 feet, you're going to be safer. Of course, we all know right now that ventilation will make a big part if this is truly aerosolization. So that will help it tremendously. So the last bit is, if you are symptomatic, please get tested. A lot of people say, oh, I'll be fine, nothing's going to happen to me. Because if you know you're positive, the people around you can be asymptomatic positives from your infection. And that will be an exponential site right there in terms of spread. So symptomatic people, please isolate, please get tested. That is for everybody's safety, including your own. I've had plenty of asymptomatic patients come in, but on day 7 or 8, start getting symptoms. At day 10 or 12, they're on a ventilator. So if you're having mild symptoms, please get tested so you know what's going on and that we can be prepared. Thanks. Thank you for giving me the opportunity.
Thanks, Dr. Vivek. That was really simple and interesting, especially masking up and also the vaccination part. Since we are going on to the Q&A session quickly, since Rajiv sir has to leave, and in this thing, I would like to call upon Major Manivanan sir, who is here, who would like to have who has a question for Rajiv sir. Can we unmute Major Manivanan sir, please? Sir, can we take a few questions, sir? I'm sorry, I forgot to ask you.
Yeah. No. I'll stay for 7 minutes, 8 minutes.
Okay, sir. Okay, sir. Can we unmute Major Manivanan, please?
Just looking for him. His name is not reflecting. I don't know if he has left the conversation.
Okay. Can we have Anil Nawali, who had actually emailed us their questions from Rira? Anil Nawali? Yes, I think he's here.
Yeah. Anil, can you please unmute yourself?
Hi, Anilji, you have to unmute yourself. Yeah.
Hello, am I audible?
Yes, please go ahead.
Sorry for that. Okay. I had sent 3 questions. One is like differential treatment by hospitals for APL and BPL card holders or non-card holders. A lot of exploitation is happening by the hospitals to the patients. That is causing a lot of inconvenience, a lot of trouble. Something needs to be addressed by the government. And primary healthcare centers lacking with the healthcare workers, facilities, some especially in rural areas, and people are not willing to go to the primary healthcare center. And these are the inputs that I collected from my friends who are staying in the the smaller towns and the suburban areas and all. So something requires to be done on the that part of the the hospital facilities and all. And also the insurance, the moment there is an insurance, a patient has an insurance, hospitals are charging exorbitantly, and people don't have insurance. Is probably they're charging normal prices and all. But what happens is people, when there is a family floater, that kind of an arrangement, what happens is the budget will go down. They charge exorbitantly, they charge heavily, and whatever is left in the insurance will go down. So some of these problems need to be addressed by the government, either the centrally IRDA and health department, and so these are 3 areas that I wanted to bring into your notice.
Okay. From what I understand, I don't quite understand the question about APL, BPL, because the vaccines are free. So what is the exploitation? I'm not able to understand. Is this a question about vaccine, or is it a question of on something else?
On the treatment. On the
okay.
treatment.
I'm sorry. Okay, and if there are specific instances, Vinod, if you could collect them from Mr. Nawali and just forward it to me, I will take it up with the state government.
Sure, sir. Yeah.
Definitely.
Sure. Yes, sir.
Yeah. Thank you. Thank you.
There's Odette Katrak, I think, who's lifting her.
Yeah. No spitting. Yeah. Can we unmute Odette, please? I think she's part of the no spitting campaign.
Okay.
Yeah. Hi, Odette. Please unmute yourself. Hi, Odette.
Yes. Hi, you can hear me now?
Yes.
Yeah. Okay. So I think we are definitely all wanting to keep that third wave away. What's worrying in all the COVID preventive lists is nobody is talking about spitting. Well, a few of us have, and I'm happy through Beautiful Bengaluru, we are partnering with Namma Bengaluru Foundation and a host of others, but it's a long, slow process because we are pushing a boulder up a mountain. It would be so much quicker if it came top down from the government, and we have the medical fraternity there. I think Dr. Vivek has heard me on this before as well. If we have the support of the medical fraternity saying, because we are only talking about mask distancing, hand hygiene, people lift mask, spit and put it back. They are not getting the link of saliva with spit. WHO guidelines flow from countries where spitting is not a problem. So it should be not just mask distancing, hand hygiene, but there has to be a fourth one. So we need something like this on every single government building, bus stop. So I seek your help and support to push it through to the government. It was our petition on March 16 of last year, which went viral and 41,000 signatories, and we reached it to PMO. Spitting became punishable. On paper, it is there. PM spoke about it in Mann Ki Baat. We need to now percolate it. We have a movement. We have everything in place. We have a lot of collateral strategy. So at a bottom up level, we are working, we are networking through NGOs, reaching the message to grassroots with zero funds, zero employees. We are doing this through a it's coming together well. But if we get the push from the medical fraternity, and if you could help us reach this through the government, it becomes part of Swachh Bharat, not only from COVID prevention list that critically, but here's a real chance for India to deal with this once and for all, because not just COVID will go away. TB kills 4.5 lakh people each year. India is apparently number one at 37% of world caseload, not to mention dirty cities, filthy cities, all of that. So seeking your help, sir, and the doctors, medical fraternity, I've got everything ready. I work closely with Vinod, and we can somehow push this. If you can help us push this through and add spitting on critical preventive lists and keep on saying spitting. People now associate me only with spitting. I'm not ashamed of that. It's become dinner time conversation in my home, but it has to become dinner time conversation in every home.
I got it. I get the message, Odette. What I will request Vinod to do, and I will speak to the health minister who has been on with Nama Bengaluru Foundation. So Vinod, you can set up an appointment with the health minister. I will speak to him, and you can take Odette and NBF team there and request him to make this a government movement. I will put in my whatever I can, and I will speak to him. This is an important issue, Odette. I recognize that. And
thank you, sir. For Karnataka, we've made headway. It is at the national level that we need your help as well.
Yeah,
but both.
I'm a little selfish. I'm more interested in protecting Karnataka and Bengaluru. I'm a little selfish.
Thank you, sir.
Let's get that done, and then I will.
Yes.
Thank you.
Yes. Thank you. Yeah. Okay. Ram Prakash from MSME. Ram Prakash, can we unmute Ram Prakash? I think this will be the last question for sir, because sir has to leave.
Thank you, sir. I hope you're able to hear me. I'm audible. Just have some suggestions on the whole area, because many people still now does not know that there is a daily handle for news conference run by PAB. So maybe I don't know if it can be sort of made mandatory by geotagging accounts in social media like YouTube, Instagram, or Twitter or anything, where all the PIB air accounts, Ministry of Health, and also the government handles like BBMP can be hard-coded in people to ensure they follow it, and the newsfeed comes into their media, ensuring that they are up to date with everything. Because generally what happens, that is where the genuine news comes from. That is point number one. Point number two is vaccination for daily wage workers, maids and servants. Probably, I think it's already done. I should not repeat it. But the point number three is COVID quarantine facilities for maids, servants, and admin staff, which is probably they're not something which we need to look into, because most of these people live in one-room kitchens, 1 BHKs, where chances of ventilation and people getting isolated are very less, very tough. And fourth will be, since kids play a very important role, we need to ensure we create some sort of a movement wherein we have COVID warrior champs, because they are the people who are the technology freaks in the family. They ensure that the information is dissipated amongst the parents and also amongst the relatives and also amongst the community to a good extent. Yeah. And fifth is basically to ensure we have a platform like an Arogya Setu upscaled to have SRF, BU, test IDs and everything to be incorporated in them, so that they can be better used to police in contamination zones and containment zones and all that stuff, so that even police and the people will be able to easily verify them.
Okay. Thanks, Ram.
Okay. So if Dr. Vishal Rao and Dr. Padigal, if you don't mind, I will step out of this. I have to go into another.
Thank you.
And if you can continue to take questions. Thank you. Thank you so much.
Thank you, sir.
No, sir. Thank you, sir.
Thank you.
Thank you. Wish
sir.
you all the best, sir. Thank you.
Thank you, sir. Yeah. Dr. Vishal Rao, if you could actually look at this question from our query from Ram Prakash J.
Yeah, I think he's raised a couple of very relevant points.
Yes.
I think we can make a note of this, Vinod, and follow up on these.
Okay.
I think these are very, very genuine points, and a lot of this, even what Odette said was, see, something very, very simple and something which we should be able to implement actually.
Yes. Sure. True. Can we have Rajiv Roy?
Rajiv Roy has not joined.
Okay.
Okay, we can call on Mr. Murli.
Mr. Murli, please unmute.
Just one point till then, I think for what Ram said,
Yes.
the last point for servants, I think through the Resident Welfare Association, NBF can actually start the movement and make this countrywide. I think it's a simple thing that Resident Welfare Associations come forward and make this mandatory and make this is basically vaccine passport. Talking about vaccine passport, talking about quarantine. If there's any way we can make them play a role in this to voluntarily come forward.
Yes, sir. Sure, doctor. I think we will look into this. Yes. Mr. Murli, you can go ahead with the question.
To Dr. Vishal Rao, very good evening, doctor, and very good evening to NBF Foundation, to all participants.
Good evening, sir.
Just we have been hearing that some of the message, not sure to what extent it is reliable, that the wave 3 comes with without any symptoms. There is no fever, headache, or something like that. It directly attacks the chest and the lungs as such. So what is your feedback or the message that you would like to share on this, Dr. Vishal?
So I think most importantly, what we've known globally right now is that the Delta seems to be the most prevalent strain. Now it's evolving. And one thing that is very, very classical about this virus and about its evolution is, if you see, the first wave was caused by the D614G variant. The second wave was predominantly caused by Delta. Now, we've still not completed the second wave. We've got a plateau because of a forced lockdown, but we've still not completed. The signature about the Delta variant has been its affinity to the lung. I think our pulmonologist earlier spoke about this very eloquently and very clearly about how Dr. Vivek emphasized on this. So what is needed to be done, a lot of PCR negative cases came up where were picked up in CT scan, where the radiologist picked it up and then gave it to the pulmonologist. Now, we know that there is a special affinity. The studies that have show that the symptom in the first wave if it would take 10 to 12 days, in the second wave, it was taking 3 to 5 days. So this virus is evolving its form, and in the coming days, a lot of caution is being exerted on what the ICMR is talking about. For example, the Zeta variant. The ICMR has spoken about this. It reduces the efficacy of the vaccine by nearly 6 times. So we are not looking at a situation where we've completely won over this entire virus. The symptoms of this particular virus and its nature can be aggressive. So as of now, there is no evidence to say that it is going to suddenly cause some harm like this. But nonetheless, what we know is in the coming days, based on the statistics we've used from the previous thing, like let's say Karnataka, it was 50,000 cases per day. 17% of them will require oxygen at least. 17%. Now that means in an every day it is 8,500 beds that is going to be required. Now Karnataka, how many beds does Karnataka have? About 120,000 oxygenated beds and 4,000 ventilator beds. At this juncture, in 2 weeks we will be over. We will be closed. We will not be able to run the show. So, and this virus, the more it spreads to people, the more it gets stronger. The more it survives the bodies of people, the more it gets stronger. So that is where we are today, that we know that we will need to exert a lot of caution until we come over it. And I think till July, at least of 2022, is going to be something that we will need to closely watch this globally.
Okay. All right. So in terms of other lines we read through in articles as well, Covaxin is, having some, more traction in terms of the Delta. Is that something a fact, or still an investigation is taking place on that?
That Covaxin is better for Delta, you're saying?
Yeah, Covaxin has more, fighting energy. People who got Covaxin, the labs were saying that it has got more resistance, is what been, read in the articles.
I think,
yes, right.
I think Dr. Vivek can add to this, but my take on this is, globally today, if you see published data from research articles internationally, no such data is available that this is better than this. Naturally, these companies are each individually going to tell you that our vaccine is slightly better for these variants. But one thing I want to tell you as a very simple note, for a simple logic. Remember, when they created this vaccine, they used the D614G formula. Now the variant has changed its form, and all of these vaccines are still effective, But nonetheless, the coming days, we know that the vaccine escape mutations are going to be on the rise, and all of these vaccines may be turned less effective in the coming strains if we continue the same.
Okay. Thank you, Doctor. I think we have Mr. H.R. Srinivas Rao. Can we unmute H.R. Srinivas Rao? Yeah, Mr. Srinivas Rao. Hi.
Hello.
Good evening. Welcome.
Good evening. I am Srinivas Rao here from Tanisandra, Ward number 6. So, good evening to everybody. And I listened to the specialists and our MP, Mr. Chandrasekhar speaking. Excellent presentation, and very impacting. I have few questions. So, first thing is that, see, we here, whoever is participating, our level, our type of public, okay, we have a certain higher level of awareness and we comply with so many instructions, restrictions as far as the COVID spread is concerned. We take vaccination and we ensure precaution, we take precautions and maintain social distancing, and we try to avoid unnecessarily mixing with the crowd. But my question is, how you are going to reach this message to the commoner? The problem is with the commoner, the lifestyle, their compulsions, their livelihood, these things are different. So because the doctors, Vishal Rao and other doctors, they are on the panel, I think they should impress upon the government that they have to devise some very effective measures to reach to the common man, that he has to follow these SOPs as well as he has to get vaccinated. I find that there is a lot of hesitancy in taking vaccination also. So that is one suggestion I want to do. Second thing is, see, in wards, what happens is most of the vaccination is taking place only in the PHC, near the PHC, in the one particular centralized location. For example, if Tanisandra, if you take, it stretches 1 kilometer in one direction. 5 kilometers in one direction. So the vaccination is being done at a most border, one of the northern border of the ward. So the people who are staying away, they will not know, they can't reach also, they cannot go also. So we have been insisting in the ward committee meeting that they should decentralize this. So unfortunately, this is not happening, because even today I saw there were put a board in the vaccination center that only 100 doses are available. And there are 200, 300 people who are waiting. So the problem is, I think, decentralization is not possible, is not happening because the supply shortage is there. One thing may be some staff problem, but this needs to be solved. Otherwise, we cannot cover the entire population even with the first dose. That is one thing. Third point out I'd like to talk is about the clusters. The clusters like slums and where the migrant laborers, construction laborers, they stay. What is the program for getting them vaccinated and improving their living conditions? Basically, living conditions, because getting just vaccinated is not sufficient for them, because they live in such a small, close space, as somebody was telling, one single room, everybody is accommodated, and they will not have proper health facilities, infrastructure. Yeah. So how we are going to tackle this? Because this government, they should take this as an opportunity. They should seize this opportunity to improve their living conditions. There are slum development boards are there. I don't know what they are doing. So it's not happening up to the mark, whatever it is. So this is to be also to be addressed. Why I am putting these points to you people, Mr. Vishal Rao and other specialists, is that you are in the panel. You can impress the government. You can put forth these points and force them to do something positive in this direction. Last point I would like to bring out is the question of vaccinating the housemates. See what happens, I am staying in independent house. Okay. So like that, there are in my small layout, there are some 70, 80, 100 independent houses are there. So few housemates, they work in so many houses. But we don't have this thing that where we can certify, our certification to be valid or it will be accepted, so that when they go with that letter to the PHC, they will vaccinate them. So most of them are below 44. So these issues are also there. So in fact, we have requested Randeep that they should advise, they should send a circular to all the BBMP wards that when such request comes, it should be honored. But I don't know, it has not happened till now. Yes. So this is also another issue, because these housemates, they go from house to house, and unless it is available to them and it happens in one go, they will not be able to go once again in the second time, third time, fourth time, because if they are turned away saying that there is no stock, you come tomorrow, they will not go. So these are the things which are the very, very finer points, which has to be looked into by the health specialists as well as the health department and the government agencies. Thank you, sir. Thank you very much.
Thank you, Srinivas ji. I'll ask Dr. Vivek Padigal to maybe respond to this, please.
Well, it's very funny that you mentioned the outreach to different socioeconomic strata. I was actually actively involved with the video you might have been seen with a campaign by Mujhko Ba. And it was a very catchy music video which told people the importance of masking. So it's things like this that really need to go out to people. I think we need to think out of the box. I think we need to do things individually. Yes, it's important that the government does things, but as private citizens, there's many things we can do. For example, at least I know, at least in the doctor community, most of us are taking our maids to the hospital and getting them vaccinated, or providing the money to go to a private hospital and get it. I think most of us can afford the price of a vaccine for our maid or cook or driver. So I think as a private citizen, this is something we all can do. And this can be exponential, just like COVID. If we all do it, I think people will benefit and you will be safer yourself. There's definitely needs to be more outreach. I think a large amount of the employers in Bangalore are vaccinating. If you look at Ola, Uber, Swiggy, they have all of the delivery people have been vaccinated to a large extent. So I think it's happening at least through corporate responsibility, private citizens. Maybe it needs to be more coordinated. I agree with that. But I think it is happening at a very organic level. I can tell you in the last 20 days, among all the patients I've seen to the OPD, maybe 5 patients have come to see me who've not been vaccinated at all. So that is very heartening. Of course, these are educated people who come to Fortis, but they're not as all high socioeconomic status that you think of. We see all sorts of people. So definitely, I think if our leadership gives a clear, consistent message, vaccination, masking, isolation, that is important. I think we need to encourage people to utilize the COVID care centers, which have been running empty even during the height of the pandemic. So that is something to be looked at as well. How do we improve people utilizing these facilities? I think it's important that people understand if they're sick and they don't isolate, the people around them are going to get sick. And that would include their mother, their father, whatever the socioeconomic strata. And I think that realization would be important. I think somehow people are forgetting that point. So on multiple levels, I honestly don't do anything at the government level. But I think at least from our individual level, these are things we can do.
No.
I think you're muted.
Vinod.
Sorry, I am muted. Okay, I am muted. Can we unmute Joel Samuel, please?
Sir, can you unmute yourself, please?
Yes, I've done that. Yeah. Thank you, sir.
Yeah,
thank you, madam. So just a question, quick question to both our doctors. 3 questions. One is the third dose required? Because they say the span is only for Covaxin it is 28 days, and for Covishield it was 12 to 18 weeks. And the second question is those without ID cards. We have a lot of I come from Ward 63, and I work with a cluster of 4 wards in our area. There are many people without ID cards, especially Nepalis and then senior citizens, XYZ, and also students. Since there is a government plan to open schools, how do we address the student need?
Yeah, Dr. Vishal. Sir,
Yes,
Dr.
sir.
Vishal Rao, sir. Yeah.
I think to answer the first question, Mr. Joel, I was speaking about this earlier, saying that currently the US FDA itself has very clearly mandated and said no booster dose. But the controversy still lingers on, because Pfizer has initially recommended this aspect that there will be a booster dose required eventually, because there are rationales, because they have found that in 3 to 6 months there is a weaning out of the immunity. So at the maximum this may be good for a year, but beyond that you may require a booster dose, has been some of the discussions, and companies like Pfizer have gone back to the original drawing board to figure out whether they need to modify it or give a booster to keep the immunity up. So as of now, the current guideline says no, not required. This may change in the coming next months. We don't know. But as of now, Moderna, Pfizer, many of them are working on either booster dose or on modified vaccines, which are all in clinical trial modes and not to be used.
Vinod, can I add one thing to this?
Yes, please. Yes, doctor.
We all have got influenza vaccines for a long period of time. And every 6 months, the WHO modifies the vaccine based on the predominant strain or what is predicted. I think down the road, COVID is not going anywhere. It's going to be there. It's going to be endemic after the pandemic. And I think there's going to be a time where perhaps we're going to have an annual modified COVID vaccine, maybe at the same time as the influenza vaccine. But that's definite in the future. But I think people need to concentrate on getting people vaccinated first. Boosters are important, perhaps more for healthcare workers. But people really need to get people at least the first shot in, second shot in. I think especially globally, India's done a good job in the last few months, but there are a lot of places which haven't even started the vaccination programs. So when we're looking at policy like this, you're looking at not just India. And I think a lot of the confusion is that the European and North American countries have been kind of just focusing on themselves. And when they make statements like that, it causes a lot of confusion in the rest of the world. So that's my take on it. Sorry.
Yeah. Thank you, doctor. Can we unmute Ms. Sridevi Reddy, please? Sridevi Reddy? Yeah, please go ahead with the question.
Good evening, sir. Good evening to all of them who are presented here. This question I would have liked to ask to Rajiv, sir. Sir, actually this third wave is going to impact on the kids, children who is under the 18 plus. So they are not going to be vaccinated under 18 plus now. So I have to request for this government, what actions they are going to take, because in second wave we lost so many people randomly, like because of oxygen shortage, no beds, and due to this one medical this one also, and hospitalization also. But for the kids, what they are going to take actions on this is my first question. And how they are going to safeguard the kids without vaccinations.
Sridevi, Vivek sir, can I go and tell something?
Oh, please go ahead. This is totally your alley.
Yes.
Yeah. Mrs. Sridevi, I think to tell the first point, sometime back, about a few weeks back, the WHO and UNICEF together came out with a joint statement. And they came out with a joint statement and which said about reopening of schools. It had some rationale to it, and they gave a very detailed note on this jointly to say that studies that were done in Africa, studies that were done in UK on schools, found that children were less likely to transmit the virus. So there was some rationale, and one of the reasons and rationales in some very good papers internationally published shows that children have a very active thymus gland, which can recognize the antigens better, process it better, and that's how they have a much stronger immunity. Having said that, that doesn't give them a complete passport to say that they're not going to, because there's a lot of these multi-inflammatory syndromes that pediatricians have spoken about. Virologists globally have been concerned about the aspect of, that the virulence of this virus may change, and that may have some implications in children like they saw in Indonesia. So there is no right or wrong answer today, but there is a balanced answer. that education needs to be reopened in a balanced way, like an economic zone. Like how you would run your hospital or clinic, you have to run a hospital, school, which is not for entertainment, not for socialization. It is for education. And that is how you'll have to slowly open this up in a very balanced way. There is going to be a continued risk, but like I think Vivek sir very, very rightly pointed out, COVID is here to stay. How long are you going to close these things and continue to say that we are going to be at home? It's going to be difficult. So the coming days are going to be important for us to phase-wise open this in a graduated manner. Now, governments across the world have been grappling with the situation because WHO said that the younger the age group, the safer they are, the less they transmit. However, the less they comply. However, bigger the age group, the higher they will transmit, but the more they will comply. So there is going to be always this kind of a lack of balance, but we will have to start somewhere. Now the state is starting to look at the high schools because they're looking at compliance, and that's the bigger safety for them. Like Vivek sir earlier said, compliance of these particular children to the norms, to the new norms, is what they are strictly looking at, than the science saying that even if they don't comply, let's wait. No. So they are giving a priority here in a balanced way to say, let's look at the age group that can comply and slowly open up. And then we will closely monitor this particular school. So every district, along with the Pediatric Association, is going to be very closely monitoring it. Psychologists are involved now. If the positivity rate jumps up in districts, in specific schools, they'll have to take an action. They'll have to stop those areas. So this is what we're going to be closely watching in the next coming months, to watch positivity rates in schools, which the principals or school teachers will be monitoring very closely.
Thank you.
One more
Dr.
question. One more question.
No, can we, Sridevi, we have more people, so can we just move on to the next questioner, please? In the interest of time, can we have Vijay Nishant unmuted, please? Mr. Vijay Nishant?
Yeah, can you hear me?
Yeah. Go ahead, Vijay.
Sir, now see, there is a gentleman also told, and a lot of people other also pointed out actually. But I'm like, even in the first meeting of the Corona, the NBF told, I clearly suggested, even the authorities who came onto the meeting, Rajesh and Shekhar, everybody agreed. And the saying, I asked for mapping all the slum areas and set up a hand wash. Can you hear me?
Yeah, you're not very audible. Your audio is not clear. Yeah.
Can you hear me now?
Better.
Okay. Now, I clearly in the first meeting told NBF and other things, even they taken up a note also. Even authorities agreed on it. Rajesh sir also agreed on it. That I asked for all the slums has to be mapped, and there has to be a setup has to be done for washing and giving the awareness and everything. Because see, now again the people are whatever the meeting and everything, people are saying this third wave, fourth wave, something is not, it will going to keep continuing actually. Now see, this is the mistake we committed, not to have this kind of a cluster data and everything. As you told, see, these people are the movement and they're closer, their setup is closer, and I myself see in the marketplace or another place where they're not wearing the mask, they're not putting a proper the IVs and everything. So they have this understanding and everything. It has to be made remembered and everything, and because they stay closer, it's very important to give the knowledge and going to them, talking to them, it's very important. So that has to be done, sir, actually, because the data will be shown every time. It will be helpful for us to get out of the COVID, the infection and everything. Because these are the vulnerable people who keep moving to the working class people and everything. It has to be kept check. Actually, it's very important. I'm telling you again, please map this all cluster and everything. And this data will help us to government to say, see, these people are not vaccinated on what has to be done and everything. Both the way it is going to be very helpful. And we should start a campaign like a nearby slums also.
Yeah.
Giving awareness is very important.
Yeah, okay, Vijay. Can we have Dr. Vivek? If you're able
sorry,
to
I
get that
couldn't
audio
understand
clear.
most of that. Could you just summarize if I could? If you could?
Actually, his audio was very this thing. I think he's asking about the COVID clusters and also the sort of how we can, remove this quarantine as well as in terms of the urban clusters?
Short of not doing these micro clusters, I don't know what the way forward is.
Yeah.
I think one thing we've not talked about here is aggressive case contact tracing.
Yeah.
I think that is a cornerstone of control of COVID. If you see the countries who have aggressively controlled it, like Korea and Singapore, that has really been the control, where they have shined and made a difference. So, I mean, if you don't do at least this much of containment, it's going to be very difficult. It's a very, very infectious virus, and it's nothing like most of the viral diseases we know. So if we don't do this minimum, I don't see a way forward. I'm sure Dr. Vishal has more to say about this.
Sorry, Vinod, I was also not able to grasp the entire. So it was. Yes, it was regarding slums. What was the emphasis on here?
Sir, can I talk? Can you hear me?
Yeah, Vijay. You are not audible. Yeah, can you make it?
Can you hear me?
Yeah. Tell me.
I think it's better that he typed the question so that we can answer.
Yes. Yeah, can you type the question on the chat box, please? Do you have Chaitanya here? The next question was, sir, we'll take about another couple of questions and close, Dr. Vishal Rao and Dr. Vivek. Is that okay?
Sure,
we'll take a couple of more and then close, Doctor. Yeah. Can we unmute Chaitanya, please? Mr. Chaitanya.
Hello, sir.
Chaitanya, yeah, please go ahead.
My question was answered. I was asking about the school reopening and what are the precautions that the kids have to, take as a parent. What should we do?
I think to just add to what I said, the last point is that I think WHO, Government of India laid down very stringent guidelines on how schools will operate, more like a clinic or a hospital during this period. Like I told you, emphasis is on not on social and entertainment activities, but on education. And here they are devising different strategies for rural schools and different for urban schools, because urban schools have a different dynamics, rural schools have a different dynamics. So the government has already thought through it. The education minister has already devised some very clear guidelines. The Government of India is handholding them on this to look at how to phase-wise open this.
Thank you, Dr. Vishal. I think, Chaitanya, that's been answered. Do we have any more questions? I can't see anybody.
All the questions have been answered, Vinod.
Yes, Ram, you have a question? Can we?
No, Ram has already finished.
Yeah, but he has another question. He's just raising his hand.
I think he's forgotten to raise his hand, lower his hand.
No.
Yeah, can I? Yeah, sorry.
Yes.
Just wanted to touch upon one more point, which I was diagnosed with COVID on May. One thing is when the person goes to retest second time, if the person does not have a personal vehicle, they should depend on a public transport. So generally, if the person is not infected or the viral load is not gone out of the body, there are chances that the public transport which the person has used may be used later on, and that can be used as a source of contamination. So in some way, if the way the retests are done can be streamlined on like a public booth collection system or something like that, wherein you have vans running which can be tracked, where people can just hop in and give a swab and come back. Something like that of sorts would actually help to collect the swab. And so my point is to probably try to reduce the number of retests people go to collect the swabs. Some innovative ways.
Can I answer this, Vinod?
Yes, please go ahead, Dr.
Okay,
Vivek.
Dr. Vishal, that's okay. Number one point is you don't need to retest. That's the most important point here.
Thank you.
That is why we have a 17-day quarantine. After 17 days, if you've had no symptoms for 3 days, it's very unlikely that you are going to be infective to other people. So if you start from day one of your symptoms and quarantine for 17 days, there is absolutely no need to retest. In fact, I think this is a much abused thing which is going on in the community. There are certain circumstances like coming back to a hospital, maybe to a high-risk occupation, where it needs to be done. But in general public, 17 days of quarantine is enough with 3 days of no symptoms. So please don't retest. That's the most important thing. And please quarantine for 17 days. That's absolutely important.
Thank you.
Thank you. Thank you. Thank you. Thank you, Dr. Vivek. I think we have come to a close. I think most of the queries have been answered. And it's a Saturday evening, so I'd not like to keep you all waiting. I especially like to take this opportunity to thank Dr. Vishal Rao for making it in his busy schedule and on a weekend, and also Dr. Vivek for making it from his busy schedule and also making it for this webinar. I think the webinar has actually opened up a lot of and also doubts and queries that everybody had. We from Nama Bengaluru Foundation will be working consistently on Bengaluru finds Corona and to stop the spread. And as Dr. Vishal Rao said, the main three things are safe reopening, stay safe, safe transmissioning, as well as safe to make it a safe state. And as Dr. Vivek said, testing, tracking, and treatment before you can really spread, and masking and vaccination. So I thank you everybody for joining us today, and we wish to see you again. Please do drop in your queries to our email ID, and please do follow us on our Twitter handles and Facebook. Thank you so much.
Thank you, Vinod.
Yeah.
Thank
Have
you.
a great weekend. Thank you so much.
Good night.
Thank you, Usha.
Thank you, Doctor.
Thank you, Doctor.
Thank you, Dr. Vivek. Bye-bye.
Thank you, Dr. Vishal.
Thank you, Dr. Vivek.